Hello, my name is Tony, and I'm doing a video diary of the Stim Wave wireless spinal cord stimulator. This is a device that is used to help reduce chronic pain. I'm not a doctor. I'm not here to give medical advice. I'm just a patient who has recently gone through the procedure herself. And that's the only reason I'm doing this. When I went to find out information, do my due diligence to find information on what they wanted to do to me, I had a hard time finding information, especially on the wireless spinal cord stimulator, probably because it is so new. Now, first off, what the wireless spinal cord stimulator does, or even the other stimulator, it sends a signal to your brain that takes that pain signal your nerves are sending and scrambles it. So your brain doesn't recognize it as pain. And that's how it helps reduce the pain. There are two types of stimulators out there. The one stimulator has a battery to it, and it has to be changed every 6 years, which means a procedure every 6 years. And then there's the wireless version, which I opted for, and that once the permanent one is in, you're done, which is what I thought was really nice about it. It reminded me sort of like a TENS unit, if you know what a TENS unit is, only the signals are going straight to your nerves instead of being placed outside your body, and you get, the electric shock going on and on, that type of thing. For me, the process started yesterday. To see if the wireless stimulator will work, they do a trial version. With this trial version, they implant the stimulator in your back. They don't anchor it as securely as the permanent one so that they can remove it a lot easier. And you have an open incision throughout the whole trial. So for 7 days, you're going to have an open incision in your back, and it's going to have 2 leads hanging out of it. Now, this sounds scary and oh my God, but it's covered with a bandage. You don't see the incision. You don't see the leads. It's not that bad. That part of it isn't that bad. It's there for the 7 days to see if you get that pain relief before they put the permanent one in. You can't shower with it because you can't get it wet. So no showers, no baths. You can only take a sponge bath for 7 days. Thank goodness for sponge baths. And you'll have to follow your own doctor's recommendations for hygiene. I went in yesterday, and it was an outpatient surgery, which was really nice because you don't have to stay in the hospital. You can do this with a local anesthesia or general anesthesia. Most people opt for the general anesthesia. I, for personal reasons, opted for the local anesthesia. And if you can't handle pain, I wouldn't opt for the local anesthesia. If you can't stay completely still, I wouldn't opt for the local anesthesia because you do feel pressure while they're doing it. And there's one point which lasts a little bit where they're threading the leads through the nerve tissue, and you feel that. You really do. There's no way they can numb that. So if you've ever hit your funny bone or had an exposed nerve in a tooth, that's a lot what it feels like. Only imagine this exposed nerve being manipulated and it not just hurting for a little bit, it lasting throughout the whole thing. It was pretty miserable while they were doing that. The other thing, the surgery is going to last for about an hour. What happens is they set you on the table on your stomach. They give you like an epidural where they block the nerves when you're going through the local. They do their incision, they anchor the unit and everything, and once you're done, before they clean you up and bandage you up, the Stim Wave consultant who's there throughout the whole surgery turns on, activates the implant. Now, for me, that sent a jolt through my back and my legs. That was so uncomfortable and painful. It made me miserable. She backed it off. It was okay. At that point, it was activated. It was ready. They bandaged me up. I went to recovery. And in recovery, the consultant explained to me how to use the device. You get a belt, and in this belt, this pad fits. The pad itself has to be exactly in the right position. If it's off just a little, it won't transmit the signal to the implant, and you're not going to get the effect you need. There's a cord coming from this pad, which you attach the controller to, and you adjust it to the level you need. The Stim Wave consultant has 3 different programs that they could set for you, and you at home can make it higher or lower if you need more pain relief, less pain relief, if it's too strong, too weak. You have the ability to take care of that. Once I got home, it did feel uncomfortable. It was painful. But what was worse for me was the next morning. If I were to rate the pain levels on a scale, like they tell you 1 to 10, what's your pain? Coming home, I'd say probably a 7, maybe a little more. But in the morning, probably a 9. I mean, I was miserable. But as the day proceeded, the pain got a little less. Right now, I'd say it's about like at a 7. And they say that's normal. They say, you know, it's going to keep getting better. You have pain from the procedure. You have pain from the epidural. And you're battling all that pain at once. You're going to be stiff. You're not supposed to bend, twist, lift. You're supposed to pretty much stay relaxed and inactive for at least 24 hours. Throughout the trial, no bending, lifting, or twisting, though, because the implant, because it's not anchored as securely as the permanent one is, can conceivably shift, which, from what they told me, won't hurt you, but it won't give you the pain relief you need. I'm hoping for more pain relief throughout the time as day 2, day 3 comes in. I'm going to be doing more video diaries. I'll do a diary every day for the trial period. It'll be shorter than this one because you don't have to have an intro or anything involved with it. But if you're interested, please feel free to keep watching. I hope this helps. Anybody who's researching, maybe help you make a more informed decision. If I do go for the permanent, I'll let you guys know, and I'll do one regularly after the permanent procedure. And again, I gotta state, I'm not a doctor. I'm not giving medical advice or anything. I'm just a patient trying to help you through my experiences. And I really hope this helps, and I hope you enjoyed watching this, and feel free to look for any of the new diaries that'll be coming out. Thanks again. Hope this helps. Bye.